for 5 years, but I started at the PACE program as an enrollment coordinator. So I was there for about 2.5 years. And then I came on to community relations in 2021. I'm like, I have to think about the year, but but basically my role, is providing education and awareness about our programs and services, so people understand. And also just want to thank Zaina for the opportunity to present, because I think it's just helpful to have an overview on what is Medi-Cal, how does someone enroll, and also once they are under Medi-Cal, what benefits and um, services they have access to. So I'm gonna actually start sharing my screen. The screen. And slideshow. All right. Are we able to see the first slide? Medi-Cal in Orange County?
Yes.
Okay. So today's presentation will be focused on Medi-Cal in Orange County. If you have heard about us, CalOptima Health, we actually have been in the community since 1995. We're what we are called a county organized health system. So we were, we have a board of supervisors. We had a board that we report to. We were known just as CalOptima, but last year in August, they approved our updated name, which is CalOptima Health, and our updated logo to recognize us as a health plan, especially maybe for those partners and individuals that don't really frequent with us. At least they know, that we are considered to be a health plan. So all in all, a lot of times people are like, who is CalOptima Health? What do you do? So the simple way that I like to put it is we administer the Medi-Cal benefits here in Orange County. So anyone can have Medi-Cal in California, and depending where they reside in determines who administers those benefits. So in other states, you might hear the term Medicaid, but in California, we call it Medi-Cal. So if someone lives in Orange County and they have full scope Medi-Cal, then they are assigned to us. If they live in LA County, there's Health Net and LA Care. They administer those Medi-Cal benefits there. But here in Orange County, it's just CalOptima Health. And we're basically Orange County's community health plan for low income individuals, which can be families, seniors, and people with disabilities. So Medi-Cal is really focused on those that are low income and not based on age. And when you think about how many individuals we serve 1 in 4 adults and 1 in 3 children. So I always like to give the example of a school. If you think about a school, 1 in 3 children will have Medi-Cal, which when you think about it, it's really a lot. And we've been a leader in California Medi-Cal quality for 8 years in a row. So that means usually people are pretty happy overall with our programs and services. And also with our rebranding our name and logo, we did update our mission, which is to serve member health with excellence and dignity, respecting the value and needs of each person. So really our mission is to be member focused and really focus on what is it that the members need. And some current CalOptima Health updates. So I was mentioned, in healthcare, there are always things changing. So we did rebrand our name and logo last year in August. Also last year in January 1st, 2022, the CalAIM program launched, which is the California Advancing and Innovating Medi-Cal. And there's a slide that talks a little more further about that. So I'll be talking a little more in depth. We also launched the CalFresh initiative. Just with Medi-Cal, Social Services Agency determines eligibility for both Medi-Cal and CalFresh, which are 2 separate programs. But we did find that a lot of individuals were unaware of CalFresh, and which is the food stamps. So we did launch an initiative last year to promote CalFresh. We created flyers, we had events. Last year, I believe we held like 5 events in Santa Ana, La Habra, Garden Grove, Huntington Beach, and Santa Ana. And the point of these events was to enroll individuals in CalFresh for them to have the opportunity to meet with social services agency in person and also have the opportunity to get other community resources. And we also did COVID-19 vaccination clinics. So I started with the department in 2021, which is probably when COVID really started to hit. So we did, I want to say we did more than 15 COVID-19 vaccine clinics throughout Orange County to provide, the COVID-19 vaccine to those individuals that had a hard time getting it. And like I mentioned, we've been in the community since 1995. So when we started, we only had 180,000 members. Now, currently, we have 988,716 members. And that's based on our Fast Facts of August 2023. And you can find those on our webpage. But also, this breakdown is a breakdown of those that are in Medi-Cal, One Care, which is for those that have Medicare and Medi-Cal, and also the PACE program. And also our languages have expanded. So we did only start with 3 threshold languages, English, Spanish, and Vietnamese, but now we have 7 threshold languages, which are English, Spanish, Vietnamese, Farsi, Korean, Arabic, and Chinese. So a lot of our materials as well, we have them available in these 7 languages. And also our employees have expanded. So a lot of times people ask me, do you know this individual? And I'm like, you know how many individuals we have at CalOptima Health? There's so many of us in different departments. So also our employees have expanded as well. And since I kind of gave you an overall number of how many members we have, this gives a breakdown of ages and languages. So you'll see that 35% of our members are between the ages of 19 to 44, 25% children, which are ages 6 to 18, 20% 45 to 64, and we do have those that are 65 and older, that's about 12%. For the languages, majority of our members are English speaking, which are 58%, 27% are Spanish speaking, 9% are Vietnamese speaking, and for the other languages is 2% or lower. So this is just to give you a bit of more demographics on our members.
Recording in progress.
And then when talking about ethnicity, less than 44% are Latinos, 18% are white, 13% are Vietnamese, and then for the other ethnicities are 2% or lower. And that's just to give you an overview of like the demographics of our members. But a lot of times the main question is that people ask are who can receive services? Basically, who is eligible for Medi-Cal? So Medi-Cal, it is for low-income individuals and it can be for any ages, starting from babies to older adults. So children could qualify, adults, seniors. For undocumented individuals, it's up to the age of 26 and 50 and older. Last year and May 1st, they did do the older adult expansion, which meant that those that are 50 and older can qualify for full scope Medi-Cal regardless of their immigration status. Of course, they do still have to meet the other requirements, but their immigration status wouldn't be a barrier anymore for them to access Medi-Cal. Also, pregnant women can qualify, foster care children, people with disabilities, and people with specific conditions. Also, some specific conditions can help qualify an individual. Someone that maybe is on dialysis can qualify, someone that has a diagnosis of cancer. So also, again, some specific conditions can help them qualify. And how does one become a CalOptima Health member? So a lot of times too, when I'm out in the community, they come to me and like, how do I become part of CalOptima Health? So one thing to know is we simply administer the benefits in Orange County. We don't determine eligibility for Medi-Cal. So if you do have an individual that is interested in applying for Medi-Cal, they will need to complete the Medi-Cal application. And then once the social services agency receives the application, and if they do qualify, they'll receive eligibility from the County of Orange Social Services Agency, usually within 45 days. So they'll receive in a letter letting them know if they did qualify for Medi-Cal. And if they did qualify for Medi-Cal in Orange County, then that's when they get assigned to us. And as I always tell individuals, all information we receive is from the state. So once the state approves them and then it comes to us, we get notified like, hey, you have a new member. So we sent them an information packet on how they can select both their health network and doctor within 30 days. That way they can start accessing those benefits. And a reminder to individuals as well, they do need to renew that Medi-Cal application yearly. Right now, if you have been hearing about the Medi-Cal renewal / Medi-Cal redetermination, during COVID, which was probably like the last 3 years, individuals didn't have to update their contact information or update their Medi-Cal application in order to keep their Medi-Cal. But since the COVID emergency has ended, they started that process in April. So something to know, if you do have individuals on Medi-Cal, they will receive their packet 2 months before their renewal month. So right now, our big messaging to out in the community is making sure people update their contact information. That way, if they do receive that packet, it gets sent to the correct address. But also, if they do receive that packet, to fill it out and send it back within those 60 days. Because otherwise, if they don't return it, they can lose their Medi-Cal. So that's something that we definitely want to prevent, and that's our messaging right now as well. And we do have a renewal toolkit on our webpage that I can also share the link with you. So where to apply? So we talk about how social services agency determines the eligibility, but we also recognize that some individuals are not comfortable going into government offices or even crowded spaces. I always compare it going to the DMV. Who likes going to the DMV, right? If we can do everything online, I'm like, it just makes our life easier. But there are other community partners that can assist with the Medi-Cal application. So some of these partners are the Coalition of Orange County Community Health Centers, Community Health Initiative of Orange County, known as CHIOC, Cover California. So you can see their webpage and phone number that individuals can call to get assistance and enrolling into Medi-Cal. And then what to bring. So a lot of times too, individuals are like, what documents do I need to bring? So Medi-Cal is based on income. So they most likely will need to bring a proof of income. They might need a birth certificate, a proof of address, some personal ID, a social security card, a proof of citizenship or immigration documents, or in other cases, the individual taxpayer identification number known as the IT number. But as I always say, this is just a list of documents that may be needed. Every case is very different. Sometimes individuals do have very specific questions related to their case, but I always suggest it's better to speak to like someone that does the eligibility to really determine what documents are needed for them in order to apply for Medi-Cal. And then once someone is assigned to receives eligibility for Medi-Cal and is assigned to us, we send them a welcome packet with information. This is a copy or a visual of our member handbook, which basically provides all the doctors, all the health networks. A lot of times members do like this handbook, but if you know telephone books, they're about 800 pages long. We don't send 900,000 of these, but if a member wants to request a hard copy, they can call us at customer service and request one. That way we can send it to them. And there are different options in how to choose their doctor and health network. So I mentioned the provider directory that they can always look up. If they have access to internet, they can visit our caloptima.org webpage and find a Medi-Cal provider. They can always call us for assistance as well. We do have our customer service number, and then we have a county community service center, which is located in Westminster. So the Westminster location, we do have a CalOptima Health customer staff on site that's able to assist with anything that's CalOptima Health related. But we also do refer to it as a one-stop shop center because if someone is also looking for any other assistance, referrals for like housing, food, they need assistance maybe like filling out paperwork for a driver's license or a passport, they can also get assistance at that center. And we also do have the last option, which is visiting in person. So our main office is in Orange. If you know the block, we're right across from there. And then our County Community Service Center, which is located in Westminster. So individuals have different options on how to choose their doctor and health network. And this is just an example of the selection form that we do send in the packet. Again, if they want to fill this out, they can fill it out and send it back to us. But if it's just easier for them to give us a call at customer service, they can just give us a call to request their health network and provider. And this is an example of what it looks like on our webpage at caloptima.org. And if you go to the Medi-Cal provider directory, it gives you several options in choosing a doctor, a specialist, if someone wants to find a behavioral health provider, a vision provider. But again, we also do have a customer service department, which is available 24 hours a day, 7 days a week. If someone would rather just give us a call and just choose a doctor so they can start accessing their benefits. And I always tell members, I'm like, we want to make sure they choose their doctor because a lot of times they might have a doctor in mind or they might have a doctor that they know of. But if they don't choose a doctor, then we will choose one for them. And we usually choose one within 10 miles of their home address and someone that speaks their language. But also, since we do believe in providing options, members are able to change their health network and doctor every 30 days. So I always tell individuals, I've been in healthcare long enough to know that sometimes you have a great doctor, sometimes you might have a doctor that maybe you don't think, it's not the best for you. So at least for them to know that they are able to change it and don't feel like they have to be stuck with that provider. But if the doctor is in the same health network, then they would just need to call the health network to make that change. But if the doctor is in a different health network, then they will need to call us at customer service to be able to make that change. But either way, it's just good for them to know that they do have options and if they are able to change their provider if they feel like they need to do so. And these are examples of our health network. So we do have about 13 health networks that we're contracted with. So I always like to say that CalOptima Health is like the umbrella, and then below the umbrella are like these tentacles with our health networks. Because a lot of times too, individuals are like, well, I have Medi-Cal, but they're Ultimate. And I'm like, okay, well, that's one of our contracted health networks. And there really is no difference between these health networks. The only difference would be what providers are under these health networks. They all should be providing the same benefits and services. So again, just for individuals to know, there are different health networks that they can also choose from. And next we have our identification cards. Have any of you seen these cards? Yes, I see some nods. So the top card is what we call the big card, the beneficiary identification card. And this card is given by the state of California when someone qualifies for Medi-Cal. What you see on the slide is the newest version. So someone that's newly eligible will receive this version with the pretty flowers, but someone that's maybe has been on Medi-Cal for some time might have the older version, which is the white and blue one. So there's no difference in between both cards, just that the one with the flowers is the newer version and the blue and white one will be the older version. But something too that I always like to point out, because a lot of times people don't know their Medi-Cal ID number. And I used to always have to ask for it when I was over at Pace, because that's how I was able to look them up. So their ID number usually starts with the 9 and ends with a letter. So also just important for members to know. And also if you do have someone with you, at least you can point it out to them. And then the bottom card card is the CalOptima Health ID card. So if someone does have Medi-Cal in Orange County and are assigned to us, they will receive this CalOptima Health ID card, which again will have their member ID, also what health network they belong to, and their provider's name. And then also you see on the front, it has the customer service number in case they need to call us. But I always like to say like the top card is the state and the bottom card is the county, because the bottom card will depend what county someone resides in. Someone in California will receive the big card, but again, depending the county they do reside will determine the bottom card. But if they do lose the big card, they will need to call social services agency to request a new one. And if they do lose the bottom card, they can give us a call, our customer service, to request a new one, or they can create a member portal on our webpage and print it out. So just for people to know. And then examples of Medi-Cal benefits. How many of us really know what our health insurance covers? We're kind of like, we don't know, right? So a lot of the times it happens with those that have Medi-Cal. They know they have Medi-Cal, but they don't really understand what benefits they have access to. A lot of them sometimes are like, well, I know it covers the doctors, the specialists. So it does cover doctors and specialists, behavioral health services, physical, occupational, speech therapy, medicines, vision care, dental services, which I will go more in depth, lab work, if they need x-rays, immunization, especially for children as they go back to school, transportation, which I will also be talking about, hospice and palliative care. I always like to mention the hospice and palliative care because a lot of times individuals don't know that if they do reach that point of end of life, or maybe they have a loved one, that hospice and palliative care are a covered Medi-Cal benefits. And earlier I mentioned the CalAIM program, which is the California Advancing Innovative Medi-Cal. So this is a 5-year initiative that launched last year on January 1st. And right now it is very specific focus for those that have chronic conditions, those that are coming out of incarceration, and those at risk of homelessness. So it is a 5-year initiative, and every January and July, the populations kind of get, they involved other populations. I believe like next year probably it'll be children. But right now these are supports to be apart from the Medi-Cal benefits. Because when we talk about an individual's health, we talk about, you know, having access to healthcare, having access to housing, food, all of those social determinants that really contributes to someone's health. So these are meant to be community supports, and actually CalOptima Health took on all 14 of them. But some of these are like recuperative care, personal care, and homemaker services, maybe especially, you know, for seniors that are in need of those services. There's also meals, medically tailored meals. So those that are not able to cook for themselves, they can receive medically tailored meals at their doorstep. Environmental accessibility adaptations, maybe, you know, they need a ramp to be able to get into their home. So again, these are meant to be community supports on top of their Medi-Cal benefits. So if someone is interested in applying for these CalAIM community supports, they can either give us a call at customer service, or also if like the organization such as yourself fills out the CalAIM referral form, then we can also follow up with the members to see if they do qualify for any of these community supports. And then once someone is assigned to us at CalOptima Health, we do encourage them to visit their provider, especially if they do have a new doctor within 3 months of joining CalOptima Health. When I was over at PACE, we talked a lot about continuum of care, especially if someone has chronic conditions, they need ongoing medications. So we really like to, you know, let members know, make sure you visit your provider, because everything starts with the provider, whether they need to be referred to a specialist, whether they need some medications, whether they need to complete routine exams. It's just very important to visit your provider. So we do encourage members to visit their providers, usually within the first 3 months of joining CalOptima Health. And also for the referrals. So whether they need a referral for a specialist, medication, medical supplies, everything starts with their provider. So the doctor would refer them to a specialist, and usually the health network processes referrals for both specialists and supplies. Most referrals can take up to 5 business days to process, but in urgent cases, it can be decided within 72 hours, which is 3 days. So again, if someone is in need of any medical supplies or referral for specialists, the first step for them would be to visit their provider. And also for medications. So a change that also occurred last year was that we used to oversee the medication benefit, but now most prescribed medications are covered by Medi-Cal RX, which is the states. So again, the provider would write the prescription for them, and then they can also find a list of covered medications, and also just in case some medications do require prior authorization. But also important for the member to carry the big card, because now if they do go to the pharmacy, they will have to show the big card in order to be able to get their prescriptions. And all covered medications should be provided with no copay or out-of-pocket cost. But if a member does have any questions related to their medicines benefits, I like to say medicine benefits versus Medi-Cal RX, they can call the Medi-Cal RX customer service center at the 1-800 number, so they can get their answers questions. And then earlier I mentioned vision and dental. So vision and dental are Medi-Cal benefits, but they're what we refer to as Medi-Cal covered benefits, Medi-Cal carved out benefits, because we don't administer those benefits themselves. So if someone is looking for a vision provider, it is through vision service plan. So they will need to call the 1-800 number to find a vision provider in their area, but under Medi-Cal, they're able to get eye exams and eyeglasses every 2 years. Except if someone is diagnosed with diabetes, they're able to get eye exams every year, since diabetes can sometimes come with complications. And if a member is a Kaiser member, they will need to call Kaiser to get the vision benefits. And then for the dental benefits is through Smile California. So members will need to call the 1-800 number to find a dental provider in their area, but also if they have any questions related to what is covered under Denti-Cal, they can also call this number to get more information. And also for medical supplies, a provider would need to write a prescription, and then the health network processes the prescription. And I always tell individuals for medical supplies, there does have to be a medical need. So, if someone is in need of a walker, a wheelchair, make sure they do visit their doctor. That way their doctor can vouch for them as to why this individual needs this benefit. And that way they can write the prescription and the health network can process it, and they can also get this benefit. And under Medi-Cal as well, there's urgent and emergency care. And I always like to talk about urgent care services because a lot of times people are not familiar with urgent care services. So I always tell members, well, sometimes you're feeling great one day and the next morning you wake up feeling unwell. So, and we know sometimes how hard it is to get same day appointments with your doctor. So in that case, what do you do? In that case, they can go to urgent care services, which they offer same-day walk-in visits with doctors, and they would just need to call their health network to find locations that take their health network. And for either emergency room, the emergency room is really for emergency services for anything that's considered life-threatening, any serious illnesses or injuries. So we always tell the members to call 911 and go to the nearest hospital. And also important for them to have their CalOptima Health ID card. Also important to know that the ambulance transportation is covered under Medi-Cal. And I know a lot of times people hesitate to call 911 because they're like, no, they're going to charge me a bill for the ambulance ride. But the ambulance ride is a covered Medi-Cal benefit. So just for individuals to know in case they do have any emergencies. And then talking about transportation, we do have several transportation options. So we talk about the emergency transportation, which is for emergency purposes. So that would be through the ambulance. We also have non-emergency medical transportation and non-medical transportation. So I'll be talking a little more in depth on the next slides. So the non-emergency medical transportation is for those individuals that have a hard time getting into a taxi, getting into a car, that have mobility issues. So this will need to be requested by the doctor because again, there does need to be a medical need for it. And these are for individuals that are not able to use a car, bus, or taxi to get to their doctor's appointment. And it will need to be approved in advance by their health network. So if you know someone that is in need of these services, we ask for them to ask their doctor to request it. And also because then the doctor would be able to submit a physician certification statement form, basically stating why this individual is in need of these services. And then the health network would just process it and approve it so they can get this benefit. And then we also have our non-medical transportation, which is just our regular transportation. So this can be either by a taxi, a bus, a private driver, but also keep in mind that the transportation is for medical related appointments. So if they need to go visit a doctor, a specialist, they need to go to therapy, they need to pick up their medications, they're able to use the transportation for these services. Also, a lot of times when I'm at senior centers, they're like, can I use it to go to the casino? And I'm like, no, it's not for shopping, running errands. It's basically strictly for medical related appointments. But also, if they want to have an individual come with them along for their ride, they're also able to do so. So just something to keep in mind. And then we do have our transportation line, the 1833 number that's available Monday to Sunday from 8 a.m. to 8 p.m. They would just need to provide their CalOptima Health ID number, and then the representative on the other end would determine what kind of transportation is best for this member. We do encourage individuals to call 2 days in advance, but I always tell individuals, if you know when your next appointment is, it's just better to make the call because a lot of times people might wait till the last minute or might just forget about it. So if they do know when their next appointment is, it's just easier to make that phone call and request these services. We do have urgent same-day transportation, but that is limited to urgent things, like someone that's being discharged out of a hospital, if someone needs to be picked up from the emergency room or transported to dialysis or chemo. And then some financial responsibility. So I mentioned that the ambulance ride is covered, but what is not covered are the paramedic services. And these are emergency medical treatments given on the scene by a paramedic. So if an individual does receive a bill for this service, they can call their city hall for information on coverage of these paramedic services. Also, what we have is share of cost. So sometimes if individuals, if they fall above the income threshold, they might have a share of costs associated with their Medi-Cal, which means they need to pay that share of costs monthly before Medi-Cal kicks in. But again, that's determined through social services agency. So when they do receive their letter on Medi-Cal eligibility, either they will have a share of cost or not a share of cost. Also, sometimes people have private insurance. The easiest example I like to always use is Medicare and Medi-Cal, which is known as Medi-Medi. So if someone does have Medicare and Medi-Cal, Medicare would become the primary insurance and Medi-Cal is the secondary insurance. But also sometimes individuals might have a private insurance through a relative. So again, that would still be their primary insurance and then Medi-Cal becomes the secondary insurance. But if a member does receive a bill for service that they know they shouldn't be charged for, we always recommend contacting the biller who sent them the bill to remind them of their Medi-Cal coverage. And if they are still not able to assist them, they can either contact the health network or call us at customer service to be able to assist them with that. And we, under CalOptima Health too, there's other support services. So I kind of gave you an overview of the medical benefits. Also, I'm one department out of many. So we talk about our customer service, which are like our front line. So they are able to answer questions related to programs. If a member wants to file a grievance and appeal, a grievance is basically a complaint, and it can be about, maybe they were in the doctor's office, they weren't treated right, they can complain about that. If also they waited too long in the waiting room, they can also file a grievance and also an appeal. An appeal is basically, let's say, the health network processes a referral and it gets denied. The member can appeal that decision. So I always like to let members know that they also do have rights as members. A lot of times they feel like, oh, well, I'm just a Medi-Cal member. What do I have access to? Or, what am I entitled to? So they are entitled to being able to file a grievance and appeal. They can also help them change their doctor or health network. We also do have other very specific programs like the Member Liaison Program, which is to help seniors, members with disabilities or chronic conditions, and those without housing have access to care. Also, the Whole Child Model Program, which is the California Children's Services, known as CCS, and their families get better care coordination. So again, if they are looking into specific support, they can call our customer service department and we can reroute them to the correct department. We also do have case management. So that's like our nurses, social workers, and other staff that can help members learn about their health conditions, how to make changes to improve their health, connect them to community resources, develop a plan to meet their goal needs. And then also our long-term support services department, which is known as LTSS. And I would say in healthcare, we use a lot of acronyms. So I kind of have it broken down. We have the CBAS, which you're probably familiar with, community-based adult services. So those are for individuals 18 and older that do have a physical or cognitive impairment. They're able to go to a day center during the day, get lunch according to their dietary needs. And also if they need physical occupational therapy, they can also get it there. We also have our multi-purpose senior services program known as MSSP. So this is for individuals that are 65 and older that do have a hard time, with their care coordination, need extra support, can get them connected to community resources, and then also hospice and palliative care. So this department is the one that oversees these other additional support services. And we have our cultural and linguistic services. So I mentioned we have 7 threshold languages, but a lot of times we run into individuals that might be speaking another language. So if they do need interpreter and translation services, they can request it. We just, make sure they do request it in advance. Also, if they are interested in written materials available in their language. So a lot of our materials as well are available in these 7 languages: English, Spanish, Vietnamese, Farsi, Korean, Arabic. And also if someone is in the need of American Sign Language interpreter, they can also request it through our customer service department. So at least just for individuals to know if they do need interpreter and translation services, it is available to them. And then we have our health management department, which they do a lot of the health education. So they do a lot of health education on different health related topics like asthma, diabetes, high blood pressure. They are able to mail out educational materials, referrals to other programs and services. I do get a lot asked questions about this, especially, someone that's like, I'm diabetic. What can I eat to improve, my diabetes? And I also refer to PACE a lot because a lot of our PACE participants did have high blood pressure, diabetes, cholesterol. So even if they did have those conditions, kind of just teaching them how to manage those conditions to improve their health and not worsen. So if a member is interested in more of these health related topics, they can call our health management department at this number. And then part also of health education is the health screenings. So I always tell members, if you were to be given an incentive, Would you visit your provider more often? Because a lot of times people just don't go to their doctor. But we do provide health screenings for CalOptima Health members, and there are certain screenings that are eligible for an incentive, and that can be like a gift card, but members would need to download and print each incentive form. And these screenings are like preventative screenings. Like we're talking about breast cancer screening, if someone needs a diabetes A1C test, a postpartum checkup, Shape Your Life, which is a weight management program for children's ages 5 to 18. So if a member is interested in these incentives and kind of wanting to know more about the health screenings, they can call the health management department at the number below. And also we do share information on the CalFresh program, which is the food stamps. As I mentioned earlier, a lot of individuals were not aware of CalFresh. So we did do an initiative last year in which we created flyers, we created posters that are available to the community. Also, if you are in need of hard copies of materials to have at your site, you can always feel free to reach out to me. But right now, a single person can be eligible for up to $281 a month, and a family of four might be eligible for up to $939 a month. But again, this is determined by social services agency, and it does depend on their income, household size, and expenses. But now, if an individual does qualify for CalFresh, they get what they call a EBT card, known as electronic benefit transfer card, that they can use at different grocery stores. I know I've seen especially like the, what do they call it? I think the markets that fresh food. I know they also been accepting the EBT cards, and I always like to talk about CalFresh because I know especially now food stamps looks different than it did back in the day. Back in the day, you literally had to pull out the vouchers, but now if someone does qualify for CalFresh, they're able to receive the money on a card. And we did the strategy last year in April 2022, and it's something that we still promote, that we still talk about. We did do a warm line transfer for those that are CalOptima Health members to Social Services Agency. So if a member gives us a call and they're interested in applying for CalFresh, we do that warm line transfer to Social Services Agency. A lot of times individuals got confused and thought that we did the enrollment, but we don't. We simply do that warm line transfer. We also did an outbound call and text message campaign. We do find that text messages are probably the best way to reach our members. So we did do text messaging regarding CalFresh, how to apply. And also we did enrollment events last year in Santa Ana, La Habra, Garden Grove, Huntington Beach, and what was the and Anaheim. So at these CalFresh enrollment events, attendees had the opportunity to meet with social services agency in person, ask them questions, and if interested, enroll in CalFresh. And also we did create posters and flyers available for providers' offices and for the community as well. And just some different options on how to apply for CalFresh. So they can give us a call at our customer service, and then we do that warm line transfer. They can also visit getcalfresh.org or benefitscal.org, or go through any of the offices of the County of Orange Social Services Agency. And then apart from all those programs, support programs and services, we also have our behavioral health. So our behavioral health number individuals can call if they are in need of behavioral health services. And for this specific service, they don't need a referral. If a member is in need, if they're interested in therapy, group counseling, medication for behavioral health, they can give us a call at this number, and our call center can provide them information on providers that take their insurance, and we also help them make that first appointment. A lot of times individuals are hesitant on, behavioral health services, but I always like to talk about it because it is a huge issue across the board, regardless of any age. So I always like to let individuals know that if they are in need of services, we can help them find a provider. That way they can start accessing these benefits. And then we do have our satellite office in Westminster, so we are in Orange, but this is the address to our satellite office in Westminster, which we do have a CalOptima Health customer service rep on site, which are able to assist anything CalOptima Health related, but also at this one-stop center, if someone is interested in other community resources like housing, food, if they need assistance, applying for a passport, applying for an ID, they can also get assistance there. And we did redesign our webpage to make it easier for individuals to access, whether it's on their phone, computer, cell phone. But they also do have the option of creating a secure online member portal. If they want to update their personal information, they want to request a new ID card, print a copy of their ID card, or be able to change their health network. So if someone does have access to internet, they're able to create this online member portal. And then talking about choices, we are contracted with 9,662 physicians, and that includes both specialists and primary doctors. We do have our 5 PACE alternate care settings, 43 hospitals, and 34 community health centers. So we always like to let members know that they do have options available. And these are just some frequently asked questions. So if a member needs a CalOptima Health ID card, they can call us at customer service or go on their member portal. If they want to change provider, they will need to call the health network or call us at customer service. But anything related to their eligibility for Medi-Cal, it would be through the County of Social Services Agency. Also, if someone needs to transfer their Medi-Cal eligibility to another county or state, it would be through the County of Social Services Agency. And if anyone has questions related to the prescription coverage, they can call the Department of Healthcare Services, also known as DHCS. And these are the main phone numbers that I always tell individuals should have in their phone. If you've probably seen our brochure, it has all the main numbers, like our customer service, behavioral health. We do have a nurse advice line that members can call if they are in need of advice. We have our health management line and also our fraud hotline to report any frauds, and our transportation line if they are in need of transportation services. And these are other agencies' phone numbers like Orange County Behavioral Health Access Line, VSP, which is for those that are vision services, Smile California, which are for the dental benefits, and the Medi-Cal RX customer service number, which is again is for the prescriptions. So again, just some important numbers to know. So now that concludes my presentation, and on the slide, you'll see my contact information, my email, and my direct number in case you do have any questions or any other questions, probably outside of this, but also if you're in need of anything else. So thank you.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.